Welcome to another episode of Empower Speaks Healthcare Talks. Today is a very special episode. The reason being, we're partnering with the University of Toronto for their FHLIP Conference, which is the Future of Health, Leadership, Informatics, and Policy. And so you may be wondering, why are we doing this partnership as being their podcast partner, essentially? So Empower Speaks Healthcare Talks is a means to translate knowledge, disseminate knowledge within the healthcare ecosystem. So it doesn't matter what stakeholder you may be. So you can be a patient, you can be a clinician, you can be an entrepreneur, you can be, in senior leadership within a healthcare organization. And we bring all these guests to have these conversations so you, the audience member, can navigate the system a little bit better, understand the challenges. Now, what is another form or medium of knowledge translation or knowledge dissemination? Those are conferences. And so within the FHLIP conference, there's going to be a lot of that happening. And so we're going to have this platform here where we're going to pick the brains of some of those amazing speakers and members of the FHLIP conference to understand the purpose of it and disseminate a bit more of that knowledge. And so for the first episode, we have Dr. Karim Keshavjee. He is the assistant professor as well as the program director of the Master of Health Informatics program. And so we're going to pick his brain, understand the purpose of this conference. What can you as the attendee gain from this conference? And then we'll share a little bit more. So Karim, let me hand it over to you. Welcome to the podcast.
Thank you so much, Fahreen. It's a pleasure to be here.
Awesome. All righty. So let's dive right in. You kind of were in the inception of the FHLIP conference. So I want to start off by asking you, what was the purpose as a university to start this conference? So please share that thought process, the purpose of this conference.
Yeah, thank you so much. I think, when I started thinking about the FHLIP conference, I think you were there. You were part of that story, Fahreen. We were working on how do we empower patients? How do we empower the public to be part of our healthcare system? Not just people who fight for a drug or fight for this particular thing, but to actually be part of a larger conversation about how our healthcare system works. And we realized that you can't empower patients without bringing every stakeholder to the table. And I think that was the whole point, is that we need everybody at the table. And so we needed a forum in which everyone in our healthcare system can meet and have a neutral discussion around knowledge, not around technology. Because technology embeds choices. So when you choose a technology, you're forced to go down a particular pathway. Knowledge has more choice, has the ability for debate, has the ability for us to make reasoned choices and choices that benefit all of us, rather than technology, which may benefit some and not benefit others equally. And so that was the purpose of FHLIP.
Yeah, no, I agree. And I'm so happy you mentioned that point because you and I think about, this was a while back, 8 years ago, I think it was like 2018 or what have you, we wrote a paper together, which was the design for the Canadian Digital Health Policy and Practices Observatory. And we kind of named it Public Sphere. And so like you mentioned, the first year you did the FHLIP conference, I remember when you were speaking to the audience, you kind of pointed that out, that this was a way to kind of bring to life that public sphere. Like we had talked about it for years. The pandemic came out. We originally were trying to partner with other organizations, academic institutions, and then the pandemic came. And then this was another way, another iteration of it, and to kind of see it in fruition. And to your point, having patients have a seat at the table. We are very cognizant that we invite patients to the conference, that they have a seat,
Yes.
that there are, when it comes to any barriers to having them attend, we make sure we try to eliminate that. We were very conscious of that in our conversations, in our preparation, that we make sure that they are invited. And I think it's so important. And I've said this multiple times. I think sometimes we forget that we are all patients. It doesn't matter your title. It doesn't matter your profession. Maybe in the past, maybe in the future, maybe not today, but someone, a loved one, is a patient. And so whenever we talk about patients as third party, I think it's very important to take a step back and be like, hey, we are all patients. And so to be mindful of that. So I think to your point, we're very cognizant of that, and we have those conversations. We try not to shy away from it. We have one of the conversations, the first panel that we had 3 years ago. I was moderating it. We tried to talk about PHIPAA, and we talked about, is it good enough or time to modernize? And it had, we had such a great conversation that it even made the cover of the Canadian Healthcare Technology magazine because it was so important. And we tried to disseminate it and make sure that anyone in the audience member could understand, and it created a lot of noise. And so I think that's what makes it so exciting, that over the years, how do we keep that momentum? We keep having those conversations. So that being said, since the inception, now that we're hitting the 3-year mark, how has it evolved? What has changed from that first year to now? And now that, it's being its 3rd-year run, do you mind shedding some light on that piece?
For sure. I think it's come a long way. That first year was exciting. There was a lot of the key elements of what you and I had thought about and others have thought about. We got them there. But just because you have the elements, it doesn't mean that all the pieces were working well together. And uh, so yes, it was great. It was very exciting. People saw the promise, but the execution, I don't think, was quite there yet. And last year we built on that first year. Um, we got um, students more involved. We had student papers that year. There was a lot of more excitement around student engagement, uh, faculty engagement, um, researchers in the community who had heard about us started to submit papers. So we doubled the number of papers that were submitted, which I think is very important, because at the end of the day, we need a scientific basis for our conversations. Because if we have a lot of opinions and there's no scientific basis, then we end up arguing with each other. When we have facts, we can have more reasoned conversations and better debates, not about the facts, but about what goals we can achieve with the facts that are at hand. And I think, so, the second year, I think, gave us a little bit more room to maneuver, a little bit more facts on the ground. We brought in a few more key stakeholders. Unfortunately, it was the middle of the election last year, so many of the policymakers and government players just couldn't come because it was, the timing was wrong. So now I think this year, there's so many of the elements are there. I see the planning. The planning has been amazing. We've got such a great team. And I think all of those things that we were planning, I think, are now starting to get executed much, much better. So I think that's probably where I would say we're, after 3 years. It takes time,
Yeah.
it takes time. These things don't get, Rome wasn't built in a day.
Yeah, no, I agree with that. And I think it's so important to recognize you're going to have iterations. Like me being on the tech and the vendor side specifically, you'll have your first round of that product or first feature, your MVP, your minimum viable product, right? That's what we started with. And then you get better.
That's
You
it.
get feedback from the customer. So like you said, we got feedback from the audience members, what they liked, what they didn't like, what they wish to see more of. And so I think
Yeah.
to your point of those 2 years, that the data collection, right? We talk so much about AI and that uses data to better itself. So that's what we did. We gathered more data and we tried to implement that this year and use that. And, like you said, being part of the planning committee or what have you, we've tried to do that. So I think to your point, there's a lot of that and having that foundational piece. You mentioned involving a lot of faculty as well as students. So for students that are maybe interested in going to health informatics, digital health, you name it, why was it so important as an academic institution? Because you yourself are very seasoned in the health informatics space in the realm. And so you could have done this even in a different capacity. But being an academic institution, why was it so important to start this conference? Why was it so important to make sure students are involved and they get that exposure? And a lot of them are very heavily involved. Maybe if you could shed a
Yeah.
bit of light on that for students that may be listening or interested, or why it was important as an academic institution for you to do this.
Yeah, for sure. So the thing is that, look, you know, uh, our students are powerful, but they don't get an opportunity to exert that power. And what I've noticed is that their assignments are assignments. They're not real projects. And there's a difference between working on something in the real world and something that you work on in the classroom. And I wanted them to be able to apply their knowledge earlier in the real world instead of just in a classroom. And so how do you make that real for them? I started getting them to go out in the real world. I now assign projects where they have to meet with at least 25 people from 5 different stakeholder groups. Okay. So now they're doing real world stuff. And then I'm saying, well, you can't ask a student to do a real world project and then have the assignment get lost in the professor's um, inbox. Okay. It's got to go out in the world. And so FLIP is a great venue for students to not just do an assignment and get an A, but to do an assignment and start influencing the world. And so FLIP is that opportunity for students to now start influencing the world.
Yeah, no, absolutely. I think that's so important because me myself being an alumni of the Master of Health Informatics program, like I've seen the evolvement over the years and like you said, we learn the most. So part of our program is you have a practicum and you learn a lot. You have a capstone and like you said, it's the hands-on. Once you get into the workforce is where you learn. A lot of it is theory and then in real life you're like, okay, when we're preparing for a go live, what does it actually mean? When it comes to training the clinicians, what does that mean? When you get pushback, how do you navigate that? There is a reason for it most of the time. And so how do you navigate those conversations? So I think it is amazing that, you have such a heavy involvement of the students. They get exposure and in piece in terms of the release of the papers and having published papers, that's so important. So even together while I was a student, working with you and having a published paper, I think this gives an opportunity to many students because I think in my year it was myself and I had the opportunity and kind of had that privilege to be able to work with you and that opportunity came. But this way you're giving, to more students. So I think it's so important. So I may be dating myself. So this is many, many years back, but to see that involvement, I think is so important. And opportunity is the key when you're, or just in general as a human, opportunity. You can prepare for everything, but if the opportunity doesn't come or it's not there, it makes it hard. So I think it's so important that you give these students that. And like you said, having that, foundation that, hey, you can just put it in Google or chat and you can find it. And so I think that's amazing when it comes to the release of those papers. So now building off of that, so the theme for this year is silos to synergies. Do you mind elaborating what that theme actually means? Are there some sub-themes that fall under that the audience can look forward to of what kind of cultivates what the FHLIP conference is about this year?
Yes, for sure. But I just wanted to say that, that paper that you and I wrote was a starting point. That was the beginning, and at that time it was, if somebody was excited or interested, they would come to me. But I wanted to make that more available to more people, even if they didn't come to reach out and say, hey, Karim, I want to write a paper. But, going back to silos to synergy, one of the things that Canada faces, is that interoperability is a challenge in this country. Many countries are far ahead of us, when it comes to electronic prescribing. Canada is one of the last countries in the world to not have electronic prescribing. Um, data, patients having access to their data, being able to book an appointment with your family doctor. These are things that other countries have already got. Canada is still struggling with them. And it's not necessarily a bad thing. It's not a matter of blame, but it's a matter of understanding what are the root causes and what are the factors that lead to that lack of interoperability or ability for exchange of data and access to data. Because we're a very advanced healthcare system. The data is there, but accessibility is not there. And so my question to us is why? Can we figure it out? Can we understand it? Can we have a bunch of people look at the problem and bring us some ideas about how we can overcome them. And I think, we'll see a lot of different approaches being taken. You know, I don't have the list of all papers. There were 47 papers that were submitted. 22 papers were accepted. But, you can see people are thinking about data coming into the clinic and the workflows to enhance that flow of information. Mental health um, was a big uh, topic because people felt that you know people with mental health issues are falling through the cracks, and that our healthcare system doesn't serve them well, and so um, having access to data for them can help with um, um, making that care better. And so I think there's a lot of topics here that people are looking at um, interoperability from a variety of different perspectives. And I think that's very, very exciting.
Yeah, no, and I think that's so important. And like you said, the tech piece is one piece, but also the knowledge about it, right? And so I think, like you said, the mental health space. I've previously worked in that space, and I think to your point, it's so important. How do we empower them? It's still, even though we've gotten better, how do we, get past that stigmatism? The stigma that is around that still, it still exists. It's better. And so having these
Yeah.
conversations, creating that awareness, and giving a platform to have those conversations, kind of incorporated with other themes, as opposed to it being on its own, but it's holistic, where mental health, other pieces, whether it's your prescriptions, all that fall into place, so that make it, within society, that it's acceptable. It is part and parcel of us, and to make it holistic. So I think it's so important to have it incorporated and acknowledge that it's our overall holistic well-being, both mental as well as physical. And so I think that that's beautiful to have that incorporated. When you said about online prescriptions, maybe just to kind of just give a little bit more of a piece of that, right? So right now, prescriptions are still faxed. You still have a paper copy of it. And so when you're saying other countries that do have a bit more digitized, and I'm more on that side of it as well, on the pharmacy side. So if you mind just elaborating, when you say we don't have an online, prescription, what does that mean? Like, we've tried it, we've like prescribed it or what have you. Like, do you mind just elaborating so people can understand what we mean by this and why it's so important to understand these pieces?
Yes. Yeah, for sure. So, one of the things about uh, prescriptions is that we have in this country 250 million prescriptions that are written every year. That's a lot of prescriptions. Prescriptions, when not managed properly, um, they fall they they fall through the cracks. People lose their prescriptions. Thousands and thousands of prescriptions are lost. But more importantly, what happens is that patients who are given prescriptions may not understand the importance of that prescription. So what you'll end up seeing is that patients don't take their medications. They end up in hospital. They end up with heart attacks. They end up with strokes. They end up with failed kidneys. And that leads to all the um, complications that we see showing up in hospitals. Okay. The, the vast majority of our costs in our healthcare system come from unmanaged diseases. I think you and I wrote a paper on that last year, right?
Mhm.
And we showed that just for a very small number of people, um, that when those people fell through the cracks, they got preventable complications. And that's a terrible thing. And I think what we have to be able to do is say, how do we manage that? And when we have electronic prescribing, we can track every prescription. And not every prescription needs to be tracked, but many do need to be tracked. And so we should be able to know, did the patient take it to the pharmacy? Did it get dispensed? Can we see the impact of that care in their record? But when you don't know that the patient didn't take it to the pharmacy, that they didn't pick up the prescription, if you don't know that, you're not going to be looking to see, oh, did their blood pressure get controlled? And so people fall through the cracks. And doctors can't keep up with all of that. What I tell people, I said, look, even if you have 99% excellent care, 1% is what drives all the 33% of costs in our healthcare system. So being 99% good is not good enough. That's why we need all these new technologies. And digital technologies help us track down that 1%. That's why we need it.
Yeah. No, and I think that's so important. And like you explained, like your prescription is part of your treatment plan. And, even the little bits of knowledge, knowing that you need to, even though you feel better after starting your antibiotics, you need to finish the course of it. Knowing, can you take Tylenol with it? You can also, call in and speak to your pharmacist. Like they're having that knowledge that I can ask that, or that this is important. And the reason I say knowledge dissemination within healthcare is so important. So anyone in society, in the masses, can navigate it. And what do I mean by that? So my sister, she has asthma. And so this past winter, we had a really bad run of the flu. And so we couldn't get an appointment with her family physician. So we went to urgent care. And because she has asthma, he did prescribe her an antibiotics, and he told her, go for a chest x-ray. I need to make sure that it's not a lung infection. So we went for it. So we went. And so we did have an appointment a couple of days later with our family physician, virtual. And so when we went for the x-ray, I asked the front desk, I'm like, can I have access to the patient portal? And so when my sister had her appointment with our family physician, the family physician could not access that x-ray because she didn't order it. But because my sister had access to the patient portal, she was able to, my family physician was like, can you read the results? And so my sister read it to her, and she's like, okay. And so, but that is knowledge, right? My sister and I, we come from the same, so when we talk about social determinants of health, we're the same socioeconomic status. We're both educated. She's on the legal side. She's a lawyer. But I'm the one who went and asked. But that's because I have that knowledge. She herself, she's like, I would have gone for the x-ray and just gone home. And so that's what, that's why this conference and these conversations are so important for anyone, a lay person, to know these tidbits, these nuggets, that I should ask for this. My prescription means this. And so that's why I think it's so important that we have these conversations, whether it's in a podcast or a conference. And so I think it's beautiful that it's being highlighted. That being said, I know
Yes, I think that's a beautiful, beautiful example of a silo, right? Like information is held in one place, and the doctor can't get access to it. That's not a good thing.
Right.
So we need to overcome that. We need to build a bridge between the silos so that we can have synergy.
Exactly right. So yeah, so it all kind of just tied in right there, why it's so important. And so those of you that are listening, definitely attend the FHLIP conference, because there's a lot of these nuggets that'll be, very beneficial and very important. So that being said, I know we spoke a little bit about the papers that we wrote together and then presented as well in past years. And I'll make sure to link them as well. So those of you that are interested, the papers that we've written, we'll link them so you can look at them as well. So that being said, you are presenting this year as well. Do you mind shedding a bit of light on some of the papers that you're going to be presenting, and so that the audience knows what to kind of look forward to from that perspective?
Yes, for sure. So I submitted 2 papers this year. I think I've submitted several other papers, but I can't remember them all. I'll just talk about 2 of them because I think these 2 are very, very important. The first one is one on the economics of interoperability. So, the interoperability hasn't gone as well in Canada as it has in other countries. And I was wondering why. And I thought, okay, is there an economics reason for it? So I did an investigation, and I can't say that I proved that economics is the cause of it, but it's certainly, there's definitely a smoking gun there. So what I realized and what I discovered, I'm not going to share everything here because you should come to the conference and learn about it. But what I did learn is that Canada has always done things differently from every other country, and not necessarily in a bad way. Okay, we are a very advanced country. We have an excellent healthcare system, but we like to do things one way. Other countries understand the reality of the world and do things in other ways. And all of them are economic levers. So we use one lever, other countries use other levers, and because they use other levers, they're able to move forward faster. And I think we need to understand that. I don't think we are going to change the levers that we use, but we need to understand what levers we do use and then build our policies to suit those levers. And right now, we don't. We prefer one economic philosophy, and then we act as if we are using the other philosophies. And so what ends up happening is that there's no movement, when we could very easily create movement if we just aligned our policies and our actions. So that's one paper. I think it's a very exciting paper. It's a conference paper, so it doesn't look at 15 different case studies. It looks at one case study, but I think it and looking at electronic prescribing around the world, and why Australia and the US and Denmark, which are all ahead of us, why they've achieved what they've achieved, and all of them using different economic principles. And so that, I think, will be an interesting paper. The other paper, I think, is a little bit more of a theoretical paper, but looks at interoperability from the perspective of the end user. So what ends up happening is, I'll give you a little scenario, is let's think about interoperability. Okay, so we have lab results, we have x-rays, which you talked about, we have hospitals, specialists, and everybody's busy. So there's, patients are now living longer because the medications that we have today are fantastic. People live a lot longer. And we have better technologies. We have better services. So patients get sent to specialists. They get sent for more lab tests. They get sent for diagnostic imaging. And all of this information is coming into the doctor's office. And the doctor's basically getting overwhelmed. Okay, there's too much information. And there's no way for them to organize it. They put it into filing cabinets. The electronic medical record is no different than a filing cabinet. It was built on the premise that, hey, I'm going to have a filing cabinet the same way I had a filing cabinet on paper. And so electronic medical records, even though they're electronic, are still organized in folders. Every patient has a folder. Well, every time you go in, you'll notice that the doctor is browsing through your file. And even though it's click, 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 or scroll, 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 they're still having to browse it. It's not organized. And so one of the things that I did was I looked at a variety of different technologies out there that help organize information, and created a list of requirements. What does a doctor need to do in order to look after a patient? Okay, they need to be able to have fast access to your list of medications. They need to know what allergies you have. They need to know what treatments they used 5 years ago that didn't work, or that they didn't put on the allergy list, but, disagreed with you. And so they shouldn't be prescribing that medication that they tried 5 years ago and they stopped it. Okay. And so, but how can a doctor remember what they gave you 5 years ago? So what ends up happening is that we see all of these kind of inefficiencies in our system, where people are prescribing things that have already been tried. Okay. So I gave all of these criteria of what a doctor needs to do in order to be able to look after patients properly. And then I said, okay, what are the technologies that can do all of that? So I looked at 4 different technologies, and realized that one of them actually stands out, and it's one that we don't use at the moment. So I think, hopefully that will spark more research, because I think there's not enough research being done in that area, but I'm hoping that this will spark a bunch of research with this new technology. So yeah, looking forward to sharing that information with people when they come to the FHLIP conference.
Yeah, no, that's exciting. And I think both papers, I think the piece where you said about economics, I think sometimes in healthcare we forget it is still, there's a business piece to it. It's run like any other business, and you have to be cognizant of that. And so I think it's so important to have those conversations. And when you're also, like you said, when you're comparing to different countries, like you said, a lot of the papers we wrote to where we would compare and to other countries. And so sometimes it is comparing apples to oranges. Like we are a public system, our neighbors, like the States, is a private. But then when we compare to the European countries, they're similar to us. They are, public. But then you do need to be cognizant of other economic pieces and how they run as individual countries before we start comparing with one another. So I think that's very important and beautiful that you highlighted that. The second paper where you're talking about, the tools to empower, clinicians, physicians specifically, it kind of ties in because last year we wrote a paper on how to empower patients and why it's important for them to have access to their data. And so I think this can run in tandem. And what I mean by that is by empowering the clinicians, the physicians to have the tools so they can aggregate that data and better kind of, read through it and work through it. But also patients, while we're working at getting up to there where your clinicians have access to your x-rays, your allergies, or everything, you as a patient also need to have an active role where you are asking, please, can I have access to my x-rays and ultrasounds, my blood tests, make note of what allergies you have. Like, for example, my sister, she does have certain allergies for certain antibiotics. Every time she goes, she has to make a mental note of that. And she tells them she shouldn't have to, but like, that's why it's so important. It kind of ties in how last year we focused on the patient side and how to empower them. And then this year you're focusing on the clinician side. And so I think we have to remember, right? We can't be in silos. Both parties need to do their part while we get to that ideal state where everything is all, comes together and in terms of interoperability and everything's in a single place. But until then, both parties need to take ownership. When it comes to the patient side, I think having that knowledge, what does that mean? How do I take ownership? What does it mean for me to ask for my results? What does it mean? When do I ask? Who do I ask? So I think it's beautiful that both papers, it kind of ties in together. So I think that's really important. Now, kind of building off of that, I know earlier in our conversation I mentioned about the panel we did in the first year that made it to the cover of the Canadian Healthcare Technology magazine, but you have a lot of exciting speakers, panels, presentations, papers that are happening this year. Is there anything in particular that you're looking forward to? We also have a startup zone. So there's so much. I'm throwing out all these pieces because it's super exciting, but for yourself and, no biases, just something you're looking forward to that you want to share with the audience.
For sure. I think, this year we've got an opening panel that is going to be just spectacular. And we have, of course, an opening speaker. The keynote speaker for this year is going to be is Daphna Carr. She's the Assistant Deputy Minister of Health for digital health in Ontario. So I think she's new to that role. She's got a long history in the healthcare sector doing digital work. So I think that's going to be very exciting because it'll give us a sense of, what the ministry plans to do over the next year and what the vision is for our healthcare system, which I think is pretty exciting. Our scientific advisory chair for this year was Angela Copeland. Angela is the CIO for Ontario and the health cluster. And so that's very exciting because I think she brought her, unique perspective and her deep concern and interest for our healthcare system to this conference. And so that was really, really amazing to watch. We have amazing members of the scientific advisory panel, including patients, to participate. And so, I think the whole program should be fantastic. We have student presentations. We have, like you said, there's a startup zone, and there's we'll have a podcaster there on site. We'll have laptop talks. Our senior students actually did real world projects that are like province-wide or sector-wide projects that are, either exemplars that can be spread out across, can be replicated in other places, or are, very important tests of our healthcare system, testing out new ideas. And so we've had our senior students working on those kinds of projects within the healthcare system. And so they will be presenting on their findings and their experiences. So there's a lot going on this year. I mean, it's grown beyond what you and I had imagined in those days, I think, it's pretty amazing.
Yeah, no, absolutely. And I think to your point, there's like so much happening, right? And I think that's what makes it exciting. So, and the importance of attending. And if you are attending, definitely take a look at the agenda to see what you want so you don't, because we have a lot of things happening. And I think to your point, we've introduced a lot. So, like you said, having our speakers, the panels, very exciting, having some really important conversations. And in terms of the public sphere, we've been very cognizant that all players, right? So, when it comes to the government side, we have had speakers from that. We, very commonly are, hospitals, that's going to be present there as well. We have academic, institutions, and students. Students are our future, right? So I think it's very important that as we get more seasoned, the new cohort will keep coming in. So making sure that they have a place at the table to get involved and share their knowledge, because they're the ones who are going to be leading us in the future. I think also with the public,
Indeed.
yeah, exactly. With the public sphere, also the vendors. Sometimes vendors are not giving a spot at the table, and so also having that startup zone is to recognize that as well. Like we said, also like live podcasting. So for those of you that are, unfortunately not able to attend, or, what have you, or you have a talk that's going, we're going to be doing that there as well. So you'll get to pull those nuggets a bit later on. And so there's so much to look forward to. And we, like Karim said, it's evolved since the first year, and we've been very cognizant. And like he mentioned on the, the scientific committee, we've also made sure patients are there. So when we talk about the public sphere, was being very cognizant that the key stakeholders in the healthcare ecosystem, all of them have a seat at the table. And so in this conference, whether it's the government side, the patient side, the vendor side, hospital side, you name it, home care, we've tried to make sure you're all included. So that's why this makes the FHLIP conference so incredible and why it's so important for you to attend. So just wanted to throw those nuggets. So I completely in alignment. That's hard to choose one thing. That being said, I kind of want to speak about AI, artificial intelligence. It is a very hot
Mhm.
topic. Everyone's
Yes.
interested in that. Last year it was a lot about medical AI scribes. And then there's been, evolvement since then, and then the incorporation of it. So that being said, from your perspective, when it comes to AI within the healthcare ecosystem at large, but also specifically within the FHLIP conference, how's that been, included? What can people look forward to who are, can be nervous about it, can be excited about it? How are you kind of including that? So I guess it's twofold, that question, your general perspective of AI
Yeah.
in the healthcare ecosystem, so people can understand that from your knowledge. And then specifically within the FHLIP conference, how's that being incorporated and what can people look forward to in that regard?
Yeah. I think, well, of course, you can see artificial intelligence is just booming right now. And it has already entered the healthcare sector. AI scribes, I think, is one of the fastest growing technologies in primary care and in specialist care, because it really does make doctors' lives easier. And I think that's very exciting. And then, there's open evidence and several other technologies that are coming in that are making doctors' lives easier. So I think uh, that's pretty exciting. And I think we'll see more of that. I think we'll see a lot more of that. There's tremendous amount of pent up demand for solutions. And there's, of course, lots of startups and young people thinking about how we can solve those problems. So I think there's a good match for problems and solutions that's brewing out there. And I think that will lead to a lot of excitement and a lot of new technologies. So I think that's really amazing. When it comes to the FHLIP conference, you know, uh, of course, everybody's talking about artificial intelligence one way or the other. Okay. And from being able to identify people at risk for diseases to helping out with making the diagnosis, with uh, selecting treatment, creating the treatment plan, ensuring follow-up, all of those areas are where people are thinking about using artificial intelligence. And I agree with that. I think that is the way it should be done. is we need to make sure that at the end of the day, we need to make sure people are not falling through the cracks, and that AI is serving human needs and is serving human health. And I think, in my opinion, much of what we see as the huge costs of our healthcare system, much of it has to do with inequities and inequitable access to healthcare. And when people have equitable access to healthcare, I think we will see our costs go down. And so I think we need to think carefully about that. The other thing I think we need to think about is, and so, where else is AI going? And I think that's going to be the topic for next year. So we haven't selected the theme yet, but the scientific advisory panel was very clear that they would like to see something about artificial intelligence as part of that. So I will be announcing the theme for next year, and it will be very much AI based.
Yeah, no, I appreciate that. And then that's so important. And I love how you kind of explain in a general sense and specific to the FHLIP conference and on the patient side and the clinician side. I want to pick your brain a little bit more on that topic. And the reason I ask that with AI, being in society, there's a lot of fear with AI taking jobs and job loss. So from your opinion, just because you've seen being a physician yourself by background and then evolved into various states, based on what you're seeing, is there any nuggets that you want or nuances you want to share with the audience in terms of that fear when it comes to job loss with AI, with specifically in healthcare? Do you mind sharing your thoughts with the audience in that regard?
For sure. So first of all, what I'm going to say about healthcare is that, look, there's 2.5 million people who don't have a family doctor in Ontario. Okay, there's 6 million people in Canada who don't have a family doctor. That's ridiculous. This is Canada. Okay, so tell me that people are going to lose their jobs because of AI. No, they're not. Okay, we need to double the number of doctors. We need to double the number of nurses, and maybe we'll catch up. And probably we won't. Okay, so I think AI is going to need we're going to need AI to help us streamline workflows, decrease administrative processes and administrative burdens, because a doctor is basically working at 50% capacity right now, less than 50% capacity. Why? Because they have 40% administrative burden, which is burning them out, and that the burnout impairs their efficiency. Okay, so they're working at less than 50% capacity. So I think if we are able to implement electronic medical records, then artificial intelligence, then maybe what we'll see is that we have enough people, but I doubt it. I think we're going to need more people. So healthcare, I think, is going to generate more jobs because we just need them. Okay, um, and remember what artificial intelligence does. I think this is something that people don't understand very well, is that what artificial intelligence does is it allows people with less skills to perform at the level of somebody of high skills. Okay. It allows somebody with less skills to work at the level of somebody with high skills. So for example, Google Maps allows you to function at a very high level of expertise on the road, because you now know all the inroads. When the traffic on the highway is clogged up, you know all the inroads because it will find you the fastest route. Okay. Um, that was something only experts knew how to do. Okay. The rest of us were relegated to sitting on the highway in traffic. But today, Google hardly ever gets me on the highway during rush hour. It's always finding me a faster route. Okay, which I would have never taken before. So I think we need to understand that what that will do is that it will enable us to fill the competence gap in our healthcare system right now, because we do have a competence gap. The people that we have available are not enough to deal with the problems that we have. Okay. 6 million people don't have a doctor. That's a huge number. Okay. So that's the first thing I'd say. When I look beyond our healthcare system, What I'm going to say to you is that jobs have got nothing to do with technology or artificial intelligence. It's got everything to do with our policies. If our policies enable people to have jobs, we would have jobs. If policies enable people to accumulate wealth, then people will accumulate wealth and there won't be jobs. And right now, what we're seeing is a policy framework that enables large companies to accumulate more wealth rather than providing jobs. Because there's plenty of jobs, there's plenty of money. There's no need to, there's no need to focus on wealth creation, especially at a time when there's more wealth in the world than is required for even sustainability of our planet. Okay, so I think we need to understand that. And I think, and what I see is that young people are responding to this. Okay, that's why we have such a strong startup culture, is that people realize that they have to create their own job. And will they be able to? Absolutely. They will create their own jobs and they won't be dependent on large companies for their jobs. And large companies are going to be buying them out and or sustaining them. And so I think overall, we'll see that we will achieve an equilibrium because, you know, anybody can build a software now. Anybody can do use artificial intelligence. It has completely leveled the playing field. And I think that's a very important understanding, is that, you know, these new technologies really empower people to do stuff. And I think we'll see that happening very quickly over the next few years.
No.
So, I mean, you know, I'm an optimist. So hopefully my predictions will play out. But, you know, hey, it's an opinion.
Yeah, no. Appreciate you sharing that opinion, kind of walking us through the various pieces from a healthcare perspective, as well in a more general sense. One piece I want to ask is on the patient side when it comes to AI. And we talk about social determinants of health and how your socioeconomic status, your employment, education, all of that can impact that. And so, and I shared the example with my sister and I, where we're both same socioeconomic status, both educated different fields, and how one was able to better navigate and not so much the other. And so with AI present, do you think that gap will be further for patients who may be in a lower socioeconomic status? Do you think it can help bridge that gap? What are your thoughts on the AI piece for patients when it comes to quality, equity, all of that?
Technologies always favor the well-educated. Always. Okay. So we always have this situation where we have the digital divide, and we will have an AI divide, and we'll have all of these things. Okay. And so technologies compound inequities. Technologies compound inequities, and policies are the things that reverse that. Okay. So policies are the way we manage the inequities of technology. Okay. So what I always tell people, I said, look, technology always creates ethical dilemmas for us. It's the nature of technologies. Okay. So what we have to be able to do is say, how do I handle this ethical dilemma? How do I manage this ethical dilemma? And the way you manage an ethical dilemma is you open up, you make a bigger box around this thing and say, this is how I'm going to fix it. Because the thing by itself will create an inequity. Okay. So, you know, the fact that an iPhone costs $1,000 means that people who are poor are not going to buy an iPhone. And so they're not going to get access to the things that are available on the phone, or they may not understand how to use it. Their literacy level may not be quite as high as ours. Okay. So there are things that, you know, prevent people from utilizing technologies, as to the extent that they can benefit from them. Okay. And so policies enable us to equalize that. Okay. So that's why we have libraries and stuff where people can go and talk to other people with knowledge, can use technologies there and that sort of thing. So I think we need to understand that policies can make a difference, and that's what we need to work on, is what does that policy look like, and what should that policy be? And that's why the FHLIP conference has P as policy because um, you need leadership, but informatics and policy are the two things that balance each other off. But without leadership, they won't balance them off. And so that's why it's called the future of health: leadership, informatics, and policy.
That's beautiful. I love how that kind of all came together there. Building off of that, and I appreciate you explaining that and just being very upfront and transparent about what that actually means, because I think it's important to have these conversations when we talk about social terms of health and what that means.
Yes,
Um,
right.
and that being said, a lot of times people, because we have a lot of conversations of AI, and sometimes people ask, is it a bubble? In your respective opinion, do you think it's a bubble, or where do you stand in that regard, in your opinion?
No, no, the AI is not a bubble. AI is a technology that is here to stay. Okay. The bubble has got to do not with AI itself, has got to do with the data centers. Okay. People are overspending on data centers, and that's going to collapse. But that's okay. There's nothing wrong with data center collapse. What it means is that a whole bunch of companies are going to go bankrupt. What happens to technologies from bankrupt companies? They get resold at pennies on the dollar, which means that the cost of that technology are going to go down dramatically. If you overspend and the company went bankrupt, they'll just sell it. And it will then it'll be bought out by other companies who will then pick it up and start providing that service at a much cheaper rate. Okay. So that's what's going to happen. So AI is now going to get cheaper, and people are already using AI. Patients are already using AI. Okay. Let's face it. 40% of ChatGPT use is for healthcare. That's huge. Okay. And so I don't see that getting any less. And ChatGPT is just going to become better and better at providing you healthcare, because as people ask those questions, they'll just make sure that it's doing a good job. So I don't see a problem with using AI for healthcare. I just think that there needs to be better protections for people around their privacy and security. But when you're desperate, when you're sick, what are you thinking about? Are you really thinking about your privacy and security? No. So I think that's where policy needs to come in and say to ChatGPT, hey, you know what? You're not allowed to give this kind of advice unless you do two things. You make sure that you have an agreement with the patient that you'll keep their information private, and that you have the security in the back end to make sure that nobody can access that information, because now you've become a health information custodian, really. Right. And so now you need to behave like one, even though de facto you're not one, but you have to behave like one.
Yeah, no, and I appreciate that. That kind of brings me to my next question, where you were talking about the cybersecurity piece of it, like you said, privacy, what have you, and it goes on both sides, right? Whether it's the health information custodians, like who are holding that information when it comes to code grays or what have you, right? Which are cyber attacks to hospitals, you name it, or on the patient side, like you're saying, we're using chat. Sometimes the rule kind of is make sure you redact any personal information, but they'll put in their blood test or what have you to better understand what does it mean. And so from your perspective, when it comes to, like you were mentioning, policies where, you get the consent from the patient, in a more large scale, when it comes to cybersecurity, when it comes to the health information custodians and all of that, what is your thoughts on cybersecurity as we evolve in this era of AI, specifically within healthcare?
Yeah, I think, look, AI is without a doubt a future of healthcare. Okay. Um, a, Physician work and healthcare work is all knowledge work. Okay. And so AI is going to be assistive, but we're going to need to find a way to make sure that it is helpful, not harmful. Okay. Yes, there is a high misdiagnosis rate in healthcare, but it's not as big as most people think it is. Most physicians are very, very competent and function at a very, very high level. So we're trying to improve from like a 95% to a 99%. Well, that's much harder than going from 50% to 95%. And so I think we need to understand that, and that artificial intelligence, the bar for artificial intelligence is going to be very high. And what I see people mostly using it for are edge cases, things that don't show up very often, because things that show up often, they know what to do. If you ask the AI is going to tell you what you already know. And so 95% of the time, you don't need an AI because it's going to slow you down. It's going to tell you a whole bunch of things that you already know, or things that you know are incorrect. So you need it in a situation where somebody comes in and you're not quite sure because you haven't seen this in a long time. And all the treatment protocols have changed since the last time you looked at it. So that's when you need to look it up. And in the old days, you look it up in a textbook. Now you're you're having AI look it up for you and tell you what to do. It's acting like a textbook. Okay. And so I think how it fits into the workflow is going to evolve. But I think my own sense is that um, doctors, for the most part, don't need it. It's the people who don't have care from a doctor who need it. And so, my question to us is, is AI going to become a doctor for the undoctored? That, I think, is the bigger opportunity or benefit, or better yet, making somebody who has some minimal training, maybe a nurse, maybe a pharmacist, and enable them to perform at the level of a doctor in countries where there's a doctor shortage. Because I think if anywhere it's going to happen, it's going to happen in countries where the regulatory infrastructures is less stringent, and where the the need is greater. And I think that, so for me, that's what I would be looking out for is, where in the world is this going to be um, put into a package where people with less training can be taken to the level of people with higher training. That I think is the much more interesting thing to watch out for.
No, that's incredible. And so when you say countries where those that are undoctored, and so when you say when the training, do you mean maybe in countries where when it comes to facilities or access to knowledge? So you're saying those clinicians, those respective clinicians, to help them level, give them access to that knowledge as well, so they can provide that care to their patients. And
Mhm.
one piece building off of that, like you said, some countries may not be as stringent when it comes to their policies and privacy and regulation. So when it comes to cybersecurity, when it comes to AI, when it comes to code grades, which are like, cyber attacks on hospitals and all of that. And we've seen some of that. We've seen code grays in the past. What is your thoughts on the cybersecurity piece? Is that something that we also need to be more cognizant of? Is that, what are your thoughts on that piece?
Look, cybersecurity is always going to be a challenge. It's an arms race, okay? Because there are bad actors out there who are trying to influence, hack, get access to information. So there's all sorts of things going on, and there's the good guys and the bad guys. It is a situation where there's, it's kind of like a Star Wars kind of, the Empire versus the Republic kind of thing, and then you see this kind of, arms race happening with cybersecurity. I think the key here is that we just need to keep up with what's going on with the latest research and findings. I think, you know, um, the from a technology perspective, we have good suppliers of that, and we just need to make sure that we're using the things that they supply. So, for example, you'll notice that most large organizations are using Microsoft tools, not because Microsoft has the best tools, but because um, they ensure that um, your enterprise is secure. And that, I think, is a very important consideration because they give you the full package. And I think that's something that we'll continue to see, that, organizations like Microsoft and others will make sure that, um, you know, they're providing you with good security precisely because their mission of delivering good services and technologies depends on the cybersecurity part. Okay. So I think from a cybersecurity perspective, I'm not concerned about that. What I am concerned about is um, our propensity to think about AI as being biased. And I'm going to say something very controversial. AI is not biased. Humans are biased.
Okay.
And AI is trained on data that humans collect. And so it becomes biased precisely because we are biased.
Okay. Just to follow
Okay.
to that, so you mean when we're saying the data we collect, like in healthcare, when it came to like a heart attack or have you would know like a man like on his left arm he would feel pain. Women present differently. Do you mean the data we collect, or do you mean when they're saying you're talking to chat and it has a tendency to agree with you that biasy? Do you mind elaborating what you mean
Yes.
specifically?
Yes. So for sure. So the thing is that think of it this way. Okay. Um, let's pretend that we have trained an AI model
Mhm.
and it is biased. There are some X-ray AIs that will read the X-ray and are not really looking at the pathology. They're looking at other things and predicting based on other things. Like, oh, this is a elderly woman. Oh, much more likely to have X versus Y, and so we'll predict based on that, as opposed to the actual pathology. So they've had that situation. So, meaning that AI is biased, meaning that it's not focused on the right thing, and therefore it will make mistakes. Okay.
Mm.
So now you say, okay, well, and some of it that is correct. So it might be the fault of the AI or the training of the AI, but a lot of the times it's the data that we give to the AI to train it is biased. My point is that even if it is perfectly balanced, even if it's perfectly correct, the way you use it could be biased. If I can give an example, it's like saying, I've got a car here and, it's using, it's polluting a lot, but I'm the kind of person who keeps driving it and running over pedestrians. Uh, you know, it's not the polluting engine that's causing pedestrians to die. It's me that's causing pedestrians to die. And I think we have to think about, what are we blaming here? That we should be saying it's the full car and the risk of the car, not just the risk of the engine.
I appreciate you kind of explaining that. And I hope the audience through this conversation kind of understood what you can gain from attending the FHLIP conference. This is just like a taste of some of the conversations that'll be happening and how to look at broader perspective, right? From silos to synergies, right? Having the conversations of economics, having the conversations of what is happening in the world, being cognizant and being realistic of what is and what does that mean for us. And we touched on various components of that. And so I think it's so important to be cognizant of that. So wanted to make sure we gave you a taste of what is to come, what to look forward to in the conference, some of the new pieces, some of the presentations, the talks, all of that. But some of the nuggets, I think the reason that we wanted to dive into AI is because that's what's being spoken about quite a bit. And for you to understand and take those nuggets and take it with a grain of salt and apply it to your own life as you navigate life. So that being said, as we wrap up, Karim, I wanted to hand it over to you if there was anything else you wanted to share with the audience in regard to the FHLIP conference or our conversation at large, before we wrap up. So I'll hand it over to you.
Well, thank you so much, Fahreen. I think this has been a fantastic conversation. I really enjoyed it. And, what I'm going to tell people is that, look, Flip is going to be a great place to have a strong conversation, for you to have your thoughts influenced and for you to influence the thoughts of others. And it's all about working together to make our world a better place. And it's all about making sure that all the brains that we have are brought to solve the problems of our healthcare system. That's what Flip is all about. It's about how do we as the people of Canada, the Canadians, how do we make our healthcare system the best in the world? That's what I'm aiming for. And that's what FHLIP is all about.
Alrighty, well, thank you so much, Dr. Karim Keshavjee. Make sure you do attend the FHLIP conference that's happening on February 20th. Those of you in the audience, so you don't miss any, other future amazing conversations, make sure you do subscribe to Empower Speaks. And once again, thank you so much, Dr. Karim Keshavjee.